Cancer Care. I'm your host, Dr. Murali Subramanian, medical oncologist from Bangalore. In today's episode, I will be discussing an important topic that might help someone dealing with cancer. If you or your loved one is traveling this path, I'm here to tell you a real life story. When her doctor told Sumana, who was working in one of the huge investment firm, that she had lung cancer, she was in complete denial. She was quite angry and told him to recheck the scans. She was certain she had mixed up results with someone else's. After all, Suman was healthy, only 46. She didn't smoke and she worked out every day. Above all, she did not have any symptoms. But no, the doctor had not mixed up the scans. Sumana had a type of lung cancer called adenocarcinoma. Sumana, mother of 16-year-old girl, was devastated. But it was her daughter who motivated her to take control of her emotions and her treatment. Sumana is undergoing her treatment, and in her words, when you're faced with something like this, you have to make every moment count. That's the only way to get through it, day by day, day by day. Over years of treating cancer survivors, I wish there is more public awareness on how to support cancer fighters. I will share with you some basic techniques that patients have found beneficial. How do I cope up with changes in my body? A cancer diagnosis and treatment can bring about physical changes to your body and impact your body image. It may include loss of hair, scars, loss of appetite, bowel bladder control issues, pain, fatigue, and drastic weight changes. This leads to a completely new way of life that is very difficult to adapt to. The changes in your body are a constant reminder of your cancer. But remember that it is normal to experience a range of emotions when coping with these changes to your body. Give yourself time to adjust and try to avoid going down the path of decreased self-esteem, social isolation, anxiety, and depression. We will be discussing some of the coping techniques that will help you during this journey. Many cancer survivors constantly worry that the cancer will come back. They live with this constant fear. It is important to care for yourself and your body even though you don't feel like it. Following self-care tips have helped most survivors. Exercise. Even a short walk releases endorphins, a naturally occurring mood booster. Alternatively, you could consider some of the exercise videos which are available online. Practice relaxation techniques like meditation and deep, slow breathing exercises. Read and listen more to gather knowledge of your cancer, its treatment, and your medication. This helps you be prepared and in control. Discuss with your healthcare worker about ways to manage these changes, including pain management. Try ways you can make yourself feel better about your appearances, like a wig, a makeup, or a customized clothing. It is fine to feel sad and not able to control emotions, but it is very important to learn to adapt. It is important to try out different ways that could positively impact you. Discuss with your close family and friends about your fears. Never keep these emotions bottled up. You will be surprised by how understanding and supportive they can be. Connect with patients who have gone through similar circumstances. You will not feel like you are the only one fighting anymore. You can talk regarding their experiences and their coping mechanisms. You can offer your support to them. Forming this circle helps a lot in the recovery process. Emotional support and positive attitude greatly impacts your ability to manage your cancer. We recommend you engage your mind with functional, positive coping techniques and communicating with your support system. Over the years, studies have shown a link between the emotional state of the patient and the eventual treatment outcome. I hope through these simple tips I have been able to illustrate the ways a person can cope during cancer. I will be back with another informative session for the benefit of the public. Until then, this is Dr. Murali Subramanian signing off. Take care and stay blessed.